Good evening and welcome. I'm Alice Knapp. I'm the CEO of the Ferguson Library, and while I'm talking, this is a perfect opportunity for you to take your cell phones and put them on silence. We're very pleased to welcome Stamford Health here for this evening to present their 2022 Community Health Needs Assessment as an in-depth report on the state of health and healthcare in the communities it serves. And I believe it was 2019 or 2018, a really rainy night the last time we did this, so I'm glad you came back. After a presentation on the report itself, we will hear from an expert panel. Then our Stanford Health presenters and panelists will address your comments and questions. Just a couple of housekeeping. I mentioned the phones. The women's room is beyond the elevator and on your right. The men's room is directly below it, one floor down. And so now, please join me in welcoming the President and CEO of Stanford Health, Kathy Szilard.
Thank you, Alice, and thank you all for being here this evening with us and for coming out. And as Alice said, I did remember it was a terrible rainy night. It's a little chilly out there, but that's okay. We'll take a little chilly. And, you know, I suspect that you are familiar with Stamford Health. And tonight what we want to do is to have a community conversation with you about what the findings in the Community Health Needs Assessment is and ways in which we can work collaboratively to address some of those needs. So what does Stamford Health consist of? Well, you're probably all very familiar with the big hospital up on the hill. That's our signature core hospital for the organization. But you may not be aware that we have a large ambulatory footprint that stretches from Greenwich all the way up now to Westport. And it's been a key part of our success as we have grown our services, and it's been a key part of our outreach into the community for the services that we have. We also have a very large medical group, and I'm going to tell you a little bit about that as well. So we have 3,700 employees at Stamford Health. We're the largest employer in the area. And we also have provided, as I mentioned, we have this very large medical group, but it's not only our employed physicians that provide the outreach into the community, but also independent physicians. And there are over 1,000 physicians on our medical staff as well. And we also, last year, we provided over 1.4 million encounters. And an encounter is a visit in all of our sites through all of our transactions, which is extremely meaningful. I'm proud to tell you that once again, we are the only hospital in Connecticut to receive some very significant accolades. And we seek external validation of the care that we provide. We go to external agencies and we ask them, how are we doing? And so we have been recognized as a high-performing hospital by U.S. News & World Report. We have received a grade from Leapfrog, and for those of you who may not be familiar with Leapfrog, they're a watchdog agency that looks at outputs in terms of safety and patient experience, and they rate hospitals based on those objective criteria, and we have been rated as an A. And probably most meaningful is that we've received a 5-star rating, 5 out of 5, from CMS, the Centers for Medicaid and Medicare Services. And those are ratings from patients who have had our services and evaluate how we're doing. So getting these kinds of external validations are really important for us. We're known for some very sophisticated clinical services that rival the excellence of many major academic medical centers. And even though we are independent, and we pride ourselves on being independent, and I'll tell you a little bit more about why that's true in a moment, we have some very meaningful partnerships. And we like to say that we bring some of the best world-class organizations to our community. So one of them is with Dana-Farber. Dana-Farber is a premier cancer center located in Massachusetts and Boston, and they are the #1 rated cancer center in New England. And we have a very meaningful relationship with them for our physicians. They just helped us recruit a couple of physicians. We've adopted all their clinical protocols. We get access to second opinions very rapidly, either through telehealth or in person for patients who have been newly diagnosed with cancer. And very meaningfully, we have access to clinical trials. So Dana-Farber is an important relationship, and they are part of our Bennett Cancer Center, which some of you may be familiar with. We also have a very meaningful relationship with Hospital for Special Surgery, which is the #1 provider of orthopedic services. Several years ago, they came to us and said 2,500 patients leave Fairfield County every year to have surgery down in Manhattan. And we're kind of landlocked down in the city. I think you know their hospital reaches out over the FDR Drive. So we would like to grow in New York, and we can't grow unless we have a partner in Fairfield County. And so we were that partner, and we have about 12 orthopedic surgeons, 15 that are now credentialed on our medical staff that are HSS physicians. We have 4 operating rooms at the hospital, the main hospital, and several at the Tully Health Center for purely dedicated to orthopedic services. And I'm happy to tell you that this year we are on a pace to perform 2,600 orthopedic procedures at Stamford Health. And these are patients who had to leave our community and go down to New York for that care. And they're really happy they can get it in their hospital in their neighborhood. And the last very meaningful relationship for us in terms of our affiliations is with Columbia University, and that is related to our cardiac care program. We have the only full-service heart program in Lower Fairfield County. We have 2 world-class cardiac surgeons already, but post-pandemic, about 4 or 5 surgeons from Columbia that do very complex types of cardiac procedures approached us and asked us if they could come to Stamford Health to perform surgery, see patients, and to help our community. And we said yes to that, and they are now here in your community providing that services. So again, patients may not have to go down to New York for that kind of care. So I think one of the other important things about our organization is that although we're very proud of the expert care we provide, we also do that with a human touch because it's not only important to have extraordinary outcomes and great clinicians, we have to treat you with kindness. And one of the ways in which we demonstrate that is through our nursing care. And we are a magnet organization. Magnet is a designation that is provided to hospitals like ours by the American Nurses Credentialing Center. And we go through a very rigorous evaluation process every 3 years by the American Nurses Credentialing Center to see what our outcomes are, how we treat patients, and how much the voice of the nurse is heard at the bedside. And I'm happy to tell you we were redesignated as a magnet hospital, so very important. And another thing that I am really proud of is that we have been designated for the 2nd time in a row as a great place to work. I don't need to tell you that in today's environment, having the best and the brightest staff is the most important thing. And I always tell our 3,600 employees that they are our most precious resource. And so in this labor environment, we have to make sure we retain and recruit that talent, and that's hard to do. So we do it by making sure that it truly is a great place to work, that we value our employees and that we treat them well. And that is something that is part of our foundation. What I think is most relevant about tonight's conversation is the fact that we are an independent, not-for-profit hospital. What does that mean? That means that the decisions that are made at Stamford Health are made by people in your community. I don't have to go to a corporate office. We're governed by a not-for-profit board of directors that are from this community. And so we can make our decisions based on what's in the best interest of the people in this community. And I think that does make us unique as an organization. We also are very involved in this community. Our discussions around the community health needs are very relevant to us, and we take them very seriously, and it is something that we will be focusing on over the next several years to continue to make improvements in access and quality, and especially in those areas where we know needs are not met appropriately. But we feel that it would be of course, irresponsible for us to determine what are the health needs of our community. We know that we're not sure that we always have the answers. And so we do a community health needs assessment. As Alice mentioned, we were here a couple of years ago in 2019 when we completed our last community health needs assessment, and we shared with you what the results of that were. And we recently just released the 2022 health needs assessment. As before, the Community Health Needs Assessment focuses on the City of Stamford and the Town of Darien, which are the municipalities where Stamford Health is the primary provider of healthcare services. The assessment looks at data that is reported by Stamford and Darien residents, so it is the voice of the people in our communities, through both surveys and scores of in-person interviews. The three goals of the Community Health Needs Assessment is to study the health of the residents of Stamford and Darien, to prioritize the health needs that are specific to Stamford and Darien, and to encourage dialogue and collaboration to improve the health care in our community. And we know that that community conversation is so important because Stamford Health can't do it alone. We need input and collaboration through other agencies. So we take a very broad look in the Community Health Needs Assessment at the factors that impact our lives and become the basis for the Community Health Needs Improvement Plan, which we will be publishing shortly. And that is the response to the needs assessment on how we will address some of these concerns. We're particularly eager this year to share the Community Health Needs Assessment with you because it's amazing to realize just how much has happened since 2019. When the 2019 assessment was completed, that was way before the COVID-19 pandemic. It was also before the killing of George Floyd in Minneapolis. It was before the invasion of the Ukraine by Russia, the mass shootings in Buffalo, Uvalde, and other locations, the Supreme Court decision on abortion, or even the legalization of cannabis in Connecticut. For that reason, we really felt that this Community Health Needs Assessment for 2022 would be very meaningful and great interest to us and by the residents of Stamford and to Darien. Each Community Health Needs Assessment sets forth a group of priorities based on the research and input from the communities, as I mentioned. The priorities that were recommended during the 2019 CHNA included behavioral health, access to healthcare and social services, and obesity and nutrition. No one, of course, anticipated COVID-19 would arrive and provide more than 2 years of disruption to our operation, as well as the health needs of our communities. Nevertheless, we, along with our partners, made progress towards those priorities, including and through the pandemic. For example, under the behavioral health area, we initiated a partnership with Liberation Programs to expand access to behavioral health services for Stamford Health Medical Group patients. And why is that important? We heard from our primary care physicians that patients often come into their office. They might be there for a physical or for a diabetes check or a blood pressure check, and they come in and they say to their physicians very oftentimes, I'm really struggling with my mental health. I have depression or anxiety or some substance abuse issue, or someone in my family does. And our physicians are struggling at that point to figure out, when they have a room full of other patients with medical needs, what to do with that patient. And so this partnership with Liberation Programs has allowed us to place mental health workers in the primary care offices to be able to have that very warm handoff from the primary care physician and make sure that people get the kind of care that they need. So it really allows us to fill in some of the gaps that we know currently exist today. We've also been working very diligently with our new Stamford Mayor's Administration and community partners in the Youth Mental Health Alliance, which was created to address the many challenges that we know we are facing today with young people and mental health issues and a crisis. With respect to access, we successfully advocated with a coalition for the expansion of state insurance for undocumented immigrants, which will include behavioral health services. To expand access across the pandemic, Stamford Health also worked with its Vita Health and Wellness Initiative partners to create strategic messaging for socially vulnerable neighborhoods and to distribute masks and hand sanitizer. Together with our community partners, we created the No Barriers program to make sure that people who might be reluctant to come in and get a vaccine or face barriers with regard to a vaccine were able to do so. Some of them might have had troubles getting access to a computer or to register for a vaccine, and we were able to make sure that that happened on an expedited basis. We prioritized this population, and we saw a really great outcome because vaccination rates in traditionally underserved census tracts eventually topped that of other areas. Another way Stamford Health enhanced access is by expanding several of its medical group offices and hiring physicians. The medical group has grown from 148 providers in 2019 to more than 175 physicians, and now we offer virtual care for those who want to access their physicians through that method. We accept all patients, and these expansions help all patients. Finally, with respect to obesity and nutrition, Stamford Health introduced an evidence-based medical weight loss program, expanded our Kids Fans nutrition program in the Stamford Public Schools, and provided funding to Fairgate Farm so it could provide free healthy food to individuals regardless of their ability to pay. These are just a few examples of some of the ways in which Stamford Health and its community partners have taken action on the 2019 CHNA. Now that we have received the 2022 CHNA, and now that the wholesale disruption of our society by the pandemic seems to be behind us, we have the data and we have the direction that we will need to continue our progress and these many other initiatives that we need to tackle together. Before we present you with an overview of the 2022 report, let me acknowledge some of the people who helped us significantly as we prepared this report. So first of all, I'd like to thank our host, Alex Knapp, and the staff of the Ferguson Library. I said to Alice, it's so good to see people coming back and going to the library. It's a sign of vibrancy in our community. We're so fortunate to have this outstanding library here in Stamford, and it adds so much to our community as a place to live, and it serves as a vital resource. I also want to thank a number of other people who really helped us as we prepared the Community Health Needs Assessment. Juanita James and the team at the Fairfield County Community Foundation, Jody Bishop-Pullman, Stamford's Director of Health, who along with David Knopf and the Darien Director of Health provided great leadership to us as we developed the plan. We once again partnered with a company called Data Haven to collect statewide data, and I'd like to recognize the Executive Director of Data Haven, Mark Abraham. I also want to thank the people on the Stamford Health team who worked so hard to make sure that this Community Health Needs Assessment happened. Whoops, I think I passed one too quickly. I was going too slow and now too fast. I want to thank our panelists who are here tonight, who have dedicated their time to be with us here this evening. Reverend Joseph Ford, who's the senior pastor at Faith Tabernacle Missionary Baptist Church. Anka Badarina, who's the executive director of Building One Community. John Hamilton, who's the president and chief executive officer at Liberation Programs. And Vin Tufo, who's the chief executive officer at Charter Oak Communities. And we thank them for their time and their interest and their wise words that we'll hear in a little bit. And as I said, I'd like to thank the Stamford Health team that worked so hard to put this Community Health Needs Assessment together. Pam Kaprowski, who was an employee and is now an independent contractor with Cardinale Associates, who helped us. Leah Stewart, the manager of strategic planning. Maggie Vergata, who is a business intelligence analyst at Stamford Health. Laura Jordan, who is our Director of Government Affairs, and Connie Maleve Branyan, who is the Executive Director of Strategy and Business Development. And most of them are here with us this evening to participate in this conversation. So that is sort of the groundwork around the Community Health Needs Assessment, and it's rich with data. I hope that you enjoy the presentation this evening. You're really going to hear about the high-level findings, and if you want to dive in a little deeper, there are copies of the assessment out on the table, and I encourage you to pick one up. And now to deliver the overview of the report, I would like to hand things over to a Stamford Health leader who led this and serves as the executive sponsor for the Community Health Needs Assessment. Please welcome Senior Vice President, Strategy and Marketing, and our Chief Strategy Officer, Ben Wade.
Hi, everyone. How's everyone doing? Thank you all so much for being here. Can you guys hear me okay? Yeah? I'm very tall, so I never know if microphones are picking me up. So as Kathy said, I'm here to talk you through some of the high-level findings from our Community Health Needs Assessment. And the past 3 years have had profound effects on our community. Many of the trends that we saw, and you'll see this when I walk you through the data if you were here with us 3 years ago, many of the trends that we saw in 2019 carried forward into our new report that we completed in 2021, 2022. But we are also seeing in this report the results of 2.5 years of a global pandemic. And I think that's an important thing to keep in mind. A lot of the surveying that we did was done in 2021. And so if you cast your mind back to 2021, certainly 2021 was not as disruptive or as difficult or as impactful on the health of our community as 2020. But we really still were at that time feeling the impacts of COVID. And so you'll see in the statistics, sometimes things might look like they're a bit stuck, and we may actually see some, and we will see some statistics that look like they've taken a step back. And I would just ask that we all keep in mind when this survey was done, not to say that we don't need to take these statistics very, very seriously and that they don't chart a course for us over the course of the upcoming years, but it is important to keep that in mind as we look at this data. And so a little bit about the methodology before I talk about exactly what we found. So the first thing that you should know about our methodology, we employed both quantitative and qualitative analysis. So for the quantitative or numerical data, Stamford Health partnered with Data Haven, and we surveyed 500 representative adults from across Stamford and Darien. Then we incorporated secondary research from organizations like the US Census, the CDC, the Connecticut Department of Public Health, the Connecticut Health Information Management Exchange, and data directly from local organizations and agencies that we partnered with. For the qualitative or subjective data, we added individual and small group in-depth interviews and focus groups with more than 75 people, including individual citizens, representatives of VITA, and other local health-related organizations in Stamford and Darien. We were particularly focused in those interviews on underserved populations, recognizing that those populations might not have been represented in exactly the way we would have wanted them to be in the quantitative analysis. So let's dive into the data. And I will warn you, there is a lot of data here. So if you are a data nerd like me, get ready. You're about to think this is a blast. Otherwise, stick around, and I promise you we'll have a great conversation, okay? All right, so first, a bit about the population that we serve. And we're gonna take a look first at our demographics by race and ethnicity. So what this data shows is that between 2010 and 2020, Stamford's population grew by a whopping 10%. And that's before the full impact of the outmigration from New York City was felt in our community. That is big. 10% is 10 times as large as the state overall, which grew at just 1%. And in Darien, the population increased by 3.7%. This slide breaks down how our population is categorized by race and ethnicity. And this is really important for organizations like ours and others to know about so that we can tailor our services and be sensitive to the ways that individuals within different populations prefer to receive care. It also helps us understand disparities in care, which we'll talk about later in my presentation. And one thing that's important to note is that regulatory bodies, both at the state and at the federal level, are starting to demand that healthcare organizations like us look at this information to make sure that we're delivering care equitably year over year. This slide, and you could see different segments of these bars represent different races and ethnicity. We're comparing Connecticut, Fairfield County, Stamford, and Darien. And you can see that Stamford, not surprisingly, is much more diverse than Darien, Fairfield County, or the state as a whole.
Could you tell us which page in the report that is that slide, please?
I'm sorry, I don't know off the top of my head which page in the report this slide is on, although I am sure that the information is in the report. Yep. The next thing that we looked at from a demographic standpoint was the percentage of the population that is foreign-born. So here what we're seeing is what percentage of residents identify as being born outside of the United States. So this could be an 80-year-old who was born in Italy, or it could be a 33-year-old born in Guatemala who recently arrived in our country. This slide shows that 33% of individuals in Stamford were born outside of the United States. This is slightly lower than the percentage the last time we did the survey, but it's higher than Connecticut overall, which is 15%, and Darien, which is around the same amount as the state overall at 12%. Interestingly, the 2020 census also indicated that 43% of Stamford households speak a language other than English as the prominent language in that home. This information is very important for us as we make sure that we're able to deliver services in the language that people are most comfortable speaking. Next, we looked at the demographics by age. And so this is showing Stamford and Darien 2010 and 2020. And what you could see, and different segments of the bars represent different age groups, with the oldest age bracket of 65 and above in that orange color. So what you could see here is that Stamford and Darien's populations grew older over the course of the last 10 years, with the 65 plus population growing by 4 percentage points in Stamford and 3 percentage points in Darien. Now that we've seen some of the demographics, we're going to take a look at what are called the social determinants of health. So the idea behind social determinants of health is that health and well-being is about a lot more than just health care. It's about the quality of life that people have living in a community. The social determinants of health, according to the US Department of Health and Human Services, bucket into 5 different categories: educational access and quality, neighborhood safety and access to parks, social and community context, and of course, healthcare itself. We'll take a look first at the social determinant called economic stability. We know that income and poverty are very closely correlated with health status. Poverty can lead to financial stress, which can impact well-being in a myriad of ways. For example, there are people who are severely income constrained or are living in poverty may be forced to choose between basic needs, including food, shelter, or healthcare. This slide looks at poverty rates in the state, in Stamford overall, in Darien, and then by different race and ethnic groups. What you could see is that Stamford's poverty rates vary greatly by race and ethnicity. And Darien has a very low poverty rate at around 3%. Next, educational access and quality. This slide shows data about Stamford and Darien's preschool, high school, and college graduation rates. Preschool enrollment among 3- and 4-year-olds is considerably higher in our area than statewide. That is the red bar. In Stamford, the high school graduation rate, which is in the light blue, is comparable to Connecticut's as a whole, and the 52% rate for college graduates is actually a bit higher than the state. Education levels in Darien exceeded the state as a whole, with 81% of eligible children enrolled in preschool, 98% graduating from high school, and 86% holding a college degree or higher. The next factor that we looked at was neighborhood and built environment. This is the concept that where people live, work, play, and learn have an impact on their health and well-being. There are many factors that go into neighborhood and built environment, but what we're showing here is how people feel as it relates to safety in their own neighborhoods. So we asked people here, do you feel safe to go on walks at night? And here you could see the percentage of people who say they do not feel safe to go on a walk in their neighborhood at night. What you can see here is that the rate for Stamford overall is about the same as it is for the state as a whole at around 30%. But the Black community reports a rate that is 1.5 times higher than the average citizen in Stamford. Even in Darien, which is a very safe community, 10% of people say they don't feel safe going for a walk in their neighborhood at night. Next, we looked at something called social and community context, which is about the quality of the relationships that people have with their neighbors, coworkers, friends, family, and the community at large. Again, there are many factors here. I'm just showing you two pieces of information. One, how satisfied are people with the city where they live, and how satisfied are they with the responsiveness of local government. As has been the case in earlier surveys, this is very good news in Stamford and Darien. The great majority of residents say that they are satisfied with living here. And then finally, the last social determinant of health is, of course, health and healthcare. One very important factor is life expectancy or mortality rate. And what this is showing us is the mortality rates per million. There's another button that does something here. Hold on. Let me go back. So the light blue here is Connecticut. The dark blue is Stamford, and the orange is Darien. And then we're looking at this over time from 2015 to 2021. So the first thing that you'll notice is we saw a very big spike in 2020. So that's second to last data point on the lines. This spike was more pronounced in Stamford and Darien than it was in the state overall. And that's to be expected because we were hit harder by that first wave of COVID than other parts of the state. Then, as vaccines became available in 2021, you see that the mortality rate across all three of the lines drops back down. And in fact, in Stamford, the mortality rate dropped to its lowest level since at least 2015. This is very good news. Another thing that we looked at is a metric called years of potential life lost. So this is a little bit of a wonky statistic. So it took me, I'll be honest, it took me a little while to figure out how to think about this. So I'm going to do my best to explain it to you guys. And if anyone has any questions, raise your hand. And I will not leave anyone behind, okay? So the way that this works is you sum up all the deaths occurring at each age per 100,000 residents and multiply that by the number of years remaining to get to a certain age limit. And you can look at that for all different kinds of causes of death. So basically what this is telling you is how many total years of life are we missing in our community as a result of a specific disease or other issue in our community. Does that make sense? Yeah? Yes. Yes.
And usually, my cynical point of view is that when you do a breakdown by gender, in the show, men die at a younger age, which is undisputed.
That is true.
Right? 5 years or more. Across the race,
Mm-hmm.
doesn't matter who you are. And it's totally ignored in the statistics. And my cynical point of view is it's kind of like they don't want to let men know they're getting screwed by the medical complex.
Well, I was with you until that last bit. I was with.
There are various spins. Mine are
Yes.
obviously.
So you're right. So I think if we were, I haven't looked at this data cut by male versus female, but I would not be surprised to see that that's the case. I think there are many factors that go into why there's a difference, and perhaps we can get into them during the panel discussion. But you are spot on that we would see a difference between men and women here. So the thing that I want to point out here, again, is so since you guys are on board with what this data is showing us, again, we're showing Connecticut in the red, Stamford in the light blue, and then Darien in the dark blue. Again, what we could see here is the outsized impact that COVID-19 had on our community. In brief, Stamford residents lost a cumulative 575 years of life per 100,000 residents. That is a staggering statistic for our community. Yes. So if there were, for every 100,000 people in our community, we lost 575 years of life if you assume that all of them would have lived to the age of 75 if it wasn't for COVID-19. Does that make sense? Yeah, okay. So what this also tells us is that cancer is the leading cause of premature death in our community, both in Stamford and statewide. And then there's something very interesting to point out in Darien, which is that poisoning, which includes overdoses, is the second leading cause of premature death in Darien, behind cancer, but actually ahead of heart disease. So that's a very good sign in terms of how well residents of Darien are managing heart disease, but it also tells us something about what might be another community health need in that community around behavioral health and substance use. Next, we are looking at some of the most common diagnoses that are associated with hospitalizations for residents of Stamford, Darien, and Connecticut overall. Again, Stamford and Darien rank more favorably in every category other than COVID-19 compared to the state as a whole. But one thing that you can see, that second underlying cause is mental health, and then you have sort of fifth from the right, substance use. Again, mental health and substance use and overdoses are a great concern, alongside hypertension and diabetes, which we generally think of as underlying causes for hospitalization. Maybe I'll try the other button. Okay, there we go. And then finally, the health status that people report about themselves has been shown to have a very close relationship with actual current and future health. So here we're asking people, how would you rate your overall health? And this is showing the percentage of people that would rate it as excellent or very good. So here we can see that self-reported health status has declined since 2018's Community Wellbeing Survey. It seems likely that the drop is due to COVID-19 and associated behavioral health issues. One issue of particular concern is the decline for Black Stamford residents, only 44% of whom reported being in excellent or good health when surveyed in 2021, compared to 60% just 3 years before that. So, with all the data I've described, Stamford Health, along with a team of community leaders and health experts, including the public health directors of Stamford and Darien, worked to identify the top priorities for unmet health needs that we should address. And we looked at three things: the magnitude of the concern, the severity of the concern, the ability and willingness of the community to act. And based on those factors, we identified three top unmet health needs. The first is behavioral health, which includes both mental health and substance use. The second is access to primary and preventative care. And the third is housing. So you might be thinking, housing? Housing doesn't have anything to do with healthcare, but actually housing has a lot to do with healthcare. Housing underlies several of the social determinants of health that we talked about just a moment ago. And if someone is unstably housed, or if they're spending a greater percentage of their income on housing, it might be difficult for them to take care of other needs in their lives, like healthcare. So we're going to talk about each one of these unmet community health needs in turn. So first, we're going to look at behavioral health, which is defined, as I said, as mental health and substance use. This was identified as the most concerning unmet health need in Stamford and Darien. Mental health was a top concern before the COVID-19 pandemic, and we've actually seen increases in anxiety and depression since 2018. Some of that might have been a consequence of the COVID-19 pandemic and the isolation and grief that we all experienced during that time. Emergency responders from both Stamford and Darien noted an uptick in calls placed for individuals who were emotionally disturbed. And as we saw, mental health was second only to hypertension as an underlying cause of hospital encounters for Stamford and Darien residents. This is particularly true for those 75 and older. In addition, the pandemic intensified concerns about mental health in youth. Young children are exhibiting more extreme behaviors in school, and school administrators noted an increase in mood disorders, severe depression, anxiety, and suicidal ideation in older public school students. Most tragically, we know in Darien there were several deaths by suicide in the last year. At Stamford Health, as Kathy said, we've been partnering with liberation programs to make sure that our patients have access to behavioral health services when they need it. And we've partnered with other local organizations through the Youth Mental Health Alliance, and we'll be able to hear more about that during the panel. We also worked with the Connecticut Hospital Association and other hospitals, along with the state, to enact historic investments in behavioral health, including expanding service capacity, increasing the number of available staff and clinicians to care for patients, and improving access to community-based services. Here, we're looking at substance use, and this is showing us the rates of drug overdose deaths in Connecticut, Fairfield County, and then Stamford and Darien combined. So here we could see a concerning uptick in overdose deaths for all ages. However, we noted in our report that the number of people, the percentage of people who know someone who's addicted to opioids did not change over the course of the past 3 years. We also demonstrated in our data that since the legalization of cannabis in 2021, self-reported cannabis use did not increase. Still, poisoning, which includes overdoses, is a significant cause of premature death in our community. The poisoning rate in Stamford and Darien is lower than the county or the state, but there was a worrisome uptick in 2020 and again in 2021. Some encouraging signs: reported binge drinking and alcohol use among teens actually declined since 2018 in the 2021 survey. Next, we're going to look at access to primary and preventative care. Access to health care encompasses a number of items. First, it's the ability for people to obtain high-quality health care at the right time and in the right setting. This was a great concern in 2018, and it has only increased since then. This chart shows that many more Stamford residents chose to postpone or delay care in the past 12 months, with the rate increasing from around 20% to almost to 35% in 2021. Of course, primary and preventative care is the best way for people to identify problematic health concerns before they become truly life-threatening. And so someone delaying care in this way is a major concern. At Stamford Health, as Kathy said, we've worked to expand access to primary care, and we've made changes to make it easier for people to get access to health care, like virtual care, immediate care programs, and expanding access through hours and other measures. The cost of care can also impact access. This chart is showing us the percentage of the population that is uninsured. The red is 2015, and the blue is 2020. So what you could see is that across the board, across the entire state, there's been a slight decrease in the percentage of the population that's uninsured, but there's been a dramatic drop in Stamford from 14% to 10%. And the Hispanic population in particular, the rate of uninsured individuals has declined from 35% to 23%. That is a big improvement. It's still high, but the metrics are moving in the right direction. Another factor affecting access is perception. Specifically, the perception that an individual is receiving less respect or a lower quality of care than others. This perception has been rising significantly over recent years, as demonstrated in this slide. Black residents are almost twice as likely to report this perception than white residents of Stamford, and those making less than $100,000 a year are 4 times as likely to have this perception than those making more. The third and final unmet health need that we prioritized was housing. So no one needs to tell us that the cost of housing in our community is high. It's unsurprising then that interviewees expressed concern over the cost of housing in our area. Some resort to living in illegal rented units, which can present great safety concerns. Other individuals must utilize shelters, which are a limited resource in our community. As you can see on this slide, 13%, oh, am I not there yet? Oh, sorry, thanks. There we go. As you can see on this slide, now that I have it up, 13% of Stamford residents who responded to the survey said that they had experienced challenges in paying for housing for themselves and their families. This was particularly acute for Hispanic residents, 20% of whom indicated that at some point in the last 12 months, they did not have enough money to provide adequate shelter for themselves and their families. Even in Darien, which is a wealthy community, 6% of residents said that they had experienced housing challenges. In 2022, the city developed a housing affordability plan, and through that, we learned that more than 40% of households are considered housing insecure, which means that those households spend more than 30% of their income on housing. Unaffordable housing costs force some families to make challenging decisions based on their limited resources. Based on the magnitude of these issues, the severity of these issues, and the ability and willingness of our community to act, we identified these 3 priorities for the next 3 years. As Kathy mentioned, our next objective is to create a community health improvement plan together with our partners to identify what we'll do over the course of the next 3 years together, just like we did the last time around. So I know that some of the statistics that I shared today might have been upsetting. It is upsetting to think about inequity in our community. It's upsetting to think about people not having access to care. And it's certainly upsetting to think about the way that COVID-19 has impacted our community. But I'm hopeful as I think about this report. And the reason that I'm hopeful is that I know what this community can do when we pull together to make a difference on the things that we all agree are problems. And we saw that most recently, and I think most spectacularly during COVID-19. The way that this community came together and went from one of the hardest impacted communities to being one of the beacons for our state and frankly for this country in terms of vaccination rates and eventually mortality rates is something that we can all be proud of, and it will take that same spirit, all working together, to make continued progress on these issues. So with that, I promised you there would be an end to data and a conversation. And so before we get into the conversation, I see lots of hands. I did want to introduce Laura Jordan, who's going to introduce some of our panelists. Maybe I will, it looks like I, yes.
To something that you totally did not discuss,
Can we do that after the panel discussion?
because I think it's important to make it known. You spoke about people who are of different races.
Yes.
When I moved to Stamford many years ago,
Mm.
I was told that 35% of the population was Jewish. I am Jewish. Right now, we have rampant anti-Semitism. And you can't say that. We've gone to services in a temple where there's a policeman standing at the door. Don't you think this affects mental health, and this is something that needs to be looked into?
I think it's something that we can certainly discuss further after the panel discussion. You know, I think it does, what you're talking about speaks to some of the statistics we did show around people feeling safe in their community, right? And so although we didn't ask people to identify themselves according to their religious background, I think that perhaps what you're talking about might have contributed to that increase or that decrease in feelings of safety in Stamford. So it's one of many factors, I would say. So I am going to turn it over to Laura here, who's going to introduce our panelists. We'll have a brief panel discussion and then open it up for a broader conversation with all of you. Thank you.
Thank you, Ben. If our panelists could please join us up here at the table. Give you a brief introduction. I'm sorry, I missed that part. Oh, okay. Very good. Before I introduce our panelists, and we're so grateful for their generous donation of time, of their expertise tonight, I did want to recognize some officials from the city of Stamford who are in the audience. If you could please stand when I say your name. Public Safety Director Luis DeRubis. Oh, he might have just stepped out. I think he just stepped out. Reverend Winton Hill, who is the Public Safety Community Liaison. Yeah. Yeah. Thank you for being here with us tonight. The Public Health Director, Jody Bishop-Pullen. Jody. I believe I see Brittany Doobie back there. Brittany, from the Public Health Department. Thank you for your service and for being here. So first I'd like to introduce Reverend Dr. Joseph Ford, who is the senior pastor of the Faith Tabernacle Missionary Baptist Church here in Stamford. Welcome, Reverend Ford. Reverend Ford was in the audience here 3 years ago, so watch out, you may be up here in 3 years. Thank you for all of your partnership throughout the last 3 years. Anka Badrina, the Executive Director of Building One Community, the Center for Immigrant Opportunity regardless of immigration status. John Hamilton, the President and Chief Executive Officer of Liberation Programs. Vincent Tufo, the Chief Executive Officer of Charter Oak Communities, and Stamford Health's Ben Wade, our SVP of Strategy and Marketing and Chief Strategy Officer. So thank you, and I'm going to go right into the questions. I'd like to start with behavioral health. John Hamilton, could you please describe the types of behavioral health issues that our residents are struggling with, and the increase, the increase that we're seeing in volumes of folks who are struggling, and how COVID-19 impacted all of that?
Sure. Just got to move this mic. It was really high. They must have thought I was Ben. Yes, actually, I have to start out with challenging, unfortunately, that priority one for the increase in overdoses. when this report was done, there was an inconclusive medical examination of over 300 people. That since then, the Department of Public Health actually released the most recent data. There was 1,531 confirmed deaths in Connecticut for overdoses last year. That is a 27.7% increase since 2019. Up there, it was a much lower. It was 5%, which was the data that was available at the time. I don't think people understand it, but to put it in perspective, since we are at a Stamford Health Forum, more people died in this country last year of drug overdoses than breast cancer and colon cancer combined, 107,000 individuals. And as I said, that's up 27%. We also saw at Liberation Program an increase of over 20% relapse rates due to the social isolation. We know how the brain works. People do drugs to feel good or feel better. The people we see are doing drugs to feel better. I don't think anybody was feeling good during COVID, so that social isolation actually decreases the dopamine capacity that leads to depression and drug urging and relapse. So we actually had to serve more than 20% more individuals that were in our system that had relapsed than the previous year. So high levels of relapse with substance use, high levels of overdoses, unfortunately, and it went from a Oxycontin epidemic to a heroin epidemic to now a fentanyl epidemic. 85% of all the overdoses in Connecticut last year included fentanyl, which is 50 times more potent than heroin. So we actually are really leaning in on harm reduction, trying to keep people alive since this is this dual pandemic of not just COVID, but at the same time losing all these lives to the overdoses. So most of what we've seen is anxiety, depression, a sense of hopelessness and despair. If there's any kind of glimmer of hope that comes out of it, is I think it did help with destigmatizing mental health issues, because we've had a shared experience of a sense of hopelessness and despair and toxic stress and trauma. So I do believe that has actually helped people reach out for services that may not have reached out for services before. We've also increased the access towards telehealth and telemedicine for behavioral health. It's the first time that Connecticut has opened up the ability for people to gain access to get support through telehealth. So that's something that we've seen as a change, and that's a permanent change here in Connecticut. So those are some of the changes that we've seen, and we're seeing the hopeful piece is that there's less stigma now being able to ask for help.
Thank you. And can you say a few words about what Liberation Programs is doing, the City of Stamford and other organizations in response to this spike in behavioral health needs?
Yes, we actually had a meeting with Mayor Simmons last week, or as a result of, she called me the day of the overdoses, the 3 fatal overdoses in Stamford, wanting to look at what we were doing for trying to reduce the overdose responses. And we're fortunate we actually have a grant from the Bureau of Justice to partner with the Stamford Police to be able to respond to any overdose and bring an overdose specialist to the scene, and actually an overdose specialist for the family to be able to give them support, because we know that those at greatest risk for a lethal overdose is someone who just had an overdose. So the opposite of addiction is not sobriety. The opposite of addiction is connection. So it's about meeting people where they're at, and we've been very fortunate to be partnering now with the Stamford Police to really be able to offer that. That is one initiative. There's also been an initiative since July 2000, Shoulder to Shoulder with Assistant Chief Red, in collaboration with community partners, including Pacific House, Building One Community, Optimus Health, community health centers, and Stamford residents, to look for those individuals in the west side of Stamford. They come by every week to Alden Street and Smith Street, where people are congregating and oftentimes may be intoxicated and appear underhoused. A large percentage of those are undocumented individuals. And with the police and those partners that I mentioned, we try to connect them to care, to housing, to withdrawal management, which they used to call detox and outreach services. And they also extend that to the Jackie Robinson Park. And probably one of the most successful pilots that was mentioned by Kathy earlier, and Ben, July 2021, we started the integrated health program in the medical group on Long Ridge Road, where we had a full-time clinician in real time for any patient that had any depression or anxiety or stress or trauma, and that the doctor was talking to. We would meet with them immediately that day, and if when needed, get the medication, but immediately get them services. Since that program started, we've now hired 4 clinicians, and it's expanded to Greenwich, and now looking at the Darien survey, it looks like perhaps we may have to start a discussion if we might be the right agency to go in there. We can extend it to the Darien community because mental health stress and needs have been identified in that plan as well. So there's been 245 patients served. We've already discharged 89 successfully, and we presently have 159 patients in treatment in that program, just in that one office. And as I said, we're going to expand to a second office and probably a third location to deal with after hours, because the medical clinic is open during the day, and there's many teachers that have been experiencing stress and other people that work during the day that can only come in at night. So we're going to try to, again, meet people where they're at and open up access for night services as well. So we've been really fortunate that this partnership has really taken off, and we want to continue that commitment.
Thank you, John. That's a lot of progress. Vin, I know you're a leader of the Youth Mental Health Alliance. Can you describe this group a little bit and its activities?
Oh, sure. I'd be happy to do that. I'm not sure that this is on. So the Youth Mental Health Alliance is a affiliation, I suppose, of about 25 of Stanford's human service agencies, not only those that specialize in behavioral health and mental health services, but really all community agencies that interact with our youth, including the Stamford Public Schools, including Building One Community, DOMUS, Kids in Crisis, many organizations. Everyone actually on this panel is a member of the Youth Mental Health Alliance. It came together, led by Jody Bishop-Pullen, who's been talked about here tonight, as part of a conversation that took place beginning about a year ago. I think, even though it's not sort of an official cause of or a spark that started the conversations, it's really started when our school children returned to school full time after sort of hybrid work or part-time home schooling during the pandemic. So when they returned to school full time and in person September of last year, a lot of the issues that they had been dealing with, a lot of the issues that essentially they had been struggling through during COVID started to emerge, started to erupt, if you will, within the school environment. Situations that manifested themselves in terms of aggressive behavior, fighting, inability of a lot of children to really cope and deal with the social environment. But the things that Ben talked about as well in the youth population, anxiety, depression, anger, and a variety of things, really started a series of discussions at a high level in the community, in the public schools, the health department, the health commission, the mayor's office, to say, what can we do as a community to really not just respond, but to really take advantage, to bring together the resources and the potential for organizations that I mentioned to work together collaboratively on a set of solutions. So what came out of that is a organization that has been mentioned called the Stamford Youth Mental Health Alliance. It began at the beginning of this year in January to start to focus on mental health as not just a challenge that could be solved with an increase or better access to clinical capacity. That is absolutely one of the, if you will, primary responses. In other words, counseling, clinical care, psychiatric care, et cetera. But also, where can the community be involved to provide better access to support, peer support, caregiver support, support in the ministry, support among our parents, our grandparents, et cetera, to eliminate stigma and to provide direct help to children. So the goal, I suppose, or the approach that Youth Mental Health Alliance is taking by bringing all these organizations together is to really almost level the playing field between providing clinical care and preventative care and supports in the community. Thank you.
Thank you, Vin. I'd like to shift gears a little bit now and talk about another one of our top priorities that the CHNA demonstrated, and that's access to care. Reverend Ford, can you talk about some barriers that people might face when they seek care?
Yeah, some of the barriers that individuals face when they seek care is number one, having a provider or healthcare providers with shared or the same or shared lived experiences. Many times that individuals feel comfortable going to providers who have who they can identify with, whether it's culturally, whether it's an immigrant who have come, or whether it's an African American. For instance, when we talk about mental health, many times African Americans will not seek mental health because number one, that there's a stigma there in the first place, and then number two, when they do go seek mental health, those providers they go to many times don't look like them, and then they don't understand the terminology they use a lot of times, and so sometimes some of the underlying issues aren't really addressed as they should be. And so I think it's very important that you have providers who are culturally sensitive. When we talk about physicians, 2017, Serena Williams, she talked about the difficulties she had in childbirth and how she addressed it with her physicians, and they pretty much disregarded it. But she had to become her own advocate. And if it wasn't for really advocating as hard as she did, it could have been really life-threatening. And so it's very important that we are culturally sensitive and then have healthcare providers that look like us, immigrants, African Americans, whatever that may be, that you have providers that you can identify with.
Thank you very much. Anka, I'd like to turn to you. For a new arrival, what are some of the barriers that folks face when they're accessing care? And what have you seen that helps address some of those barriers?
So for new arrivals, historically, access to healthcare in the United States has been very challenging. And the main barriers tend to be cultural, economic, and linguistic. And for a portion of these new arrivals are actually also immigration status related barriers. They vary. I know that it's not the same for a Guatemalan national that might be here as an unauthorized individual with no access to legal health care, while an Afghan or an Ukrainian that have recently arrived either as a refugee or as a humanitarian parolee that have certain better access to healthcare, including Medicaid, food assistance, and placement support, for example, right? So there are differences in the barriers that newly arrived individuals have depending on their immigration status. And I say that cultural barriers play a key role. The same goes for the African American community. But just to give an example, for the Latin American community, hospitals tend to be free. So you're a new arrival, maybe from Guatemala or you name it in Central America. You paid a coyote, you still owe $7,000, and then you go to the hospital because you need some kind of care, and you go out with another $7,000 bill, right? Or for Afghan women, for example, that have very low health literacy, how do we, these kind of barriers and the cultural dynamics play a very important role. The same with language barriers. Many, again, I'm bringing up Guatemalans because it's the largest immigrant population here in Stamford, and apparently beyond Stamford. I was learning from Abraham today. But Guatemalans, many of the Guatemalan individuals that we serve actually come from an area that they speak a Mayan dialect. So Spanish is already their second language. So language barriers tend to be critical. So it's not only that, the communications that you put there have to be inclusive, but also not only the language, but the level of education, if you will. And then economic barriers, you were mentioning before about the uninsured population and undocumented population. It is critical for this population to have access to healthcare providers. It's much more complicated, right? So going to your question about ways that we can connect, I will say that the mantra that goes location, location, location in our sector is partnership, partnership, and partnership. I really think that collaboration, as being and my colleagues here were mentioning, is what makes a huge difference. What has worked has been collaborations with different providers, with AmeriCares that we work with the Stamford Health in the No Barriers program, for example, that allow us to really connect our community to the healthcare providers in town.
Thank you. And is there any advice you have for providers? You have many healthcare providers here today that would be beneficial to the immigrant population.
So I think training in cultural sensitivity is key, right? Training students before they actually become or transition into attendee roles, to train them into the realities of the community that they serve is critical. Really understanding where they are coming from, the journey that they have to endure when they are coming here, and also what they have to face once they are here, right? Most of the recent arrivals are actually Black and brown communities, so not only they are coming from trauma back in Afghanistan, in Mexico, or wherever it is, but they face all the journey of, the number of women that are raped when they do the journey here is 8 out of 10. So they are coming with a lot of trauma on the way, and then they come here and they don't even know how to navigate the system. So really training attendees or students is critical. And not only through organizations like B1C, that is the referent for the immigrant community, but also to listen directly to the voices of the immigrant community and listen to their stories will make you a better advocate for the services that, the providers really offer.
Thank you for sharing that advice. It's very important. I'd like to shift to housing, which is the third top priority that the data revealed. Vin Tufo, CEO of Charter Oak Communities, can you please tell us, what do you think is the most pressing housing need at this moment?
There's not enough of it that is affordable. So Ben mentioned the affordable housing study that had been conducted by the city, just completed in the spring of this year. That was really an exhaustive look of not only what the needs were, but what is the supply at different levels of income, different types of housing, multifamily, single family, rental, home ownership, and what are some of the changes that have taken place in the housing landscape using the census, the 2020 census, as kind of the indicator. And what the study really showed in a lot of ways is that from 2010 to 2020, housing has become less affordable. There is less inventory on the market. Low income or lower income rental housing has declined in significant numbers, replaced by higher income rental housing. So in other words, we may not have lost units, but we've lost units at low levels of affordability. A lot of folks have had to leave Stamford. And this is not just a couple of dozen or a few hundred people, a few thousand people. Depending on how you slice the numbers, between 3,000 and 4,000 lower income families, mostly minorities, high percentage of African American families, have had to leave Stamford over the last even 10 years. And that trend had started prior to that and certainly is continuing. They've been replaced by higher income families. In other words, the population has grown, but it's grown in greater numbers among those who earn over $150,000 a year. And generally older folks that have come in between 55 and 75. And the similar trend, again, on the loss of younger individuals between 34 and 55 has really changed, if you will, the predominant population in Stamford. Another statistic that is really important when we look at things that help folks feel safe and connected in their communities is that a lot of lower income families, households, that were homeowners, that owned homes, maybe generationally. In other words, they may have owned it through their parents, or they may have bought homes 20 or 30 years ago. They have left Stamford, lower income families in neighborhoods like the Cove, the East Side, West Side, and those, if you will, those properties have turned into rental housing. In some cases, not very good rental housing because the conditions have deteriorated. So if you really put that all together, Stamford's becoming a more expensive place to live, almost a more exclusive place to live, right? It has changed in ways that do harm, certainly our more vulnerable neighborhoods, neighborhoods where there's a concentration of low-income folks, and certainly communities of color. And it has become a place where people have had to sacrifice. As Ben said, people have had to sacrifice between being able to afford housing and being able to afford things like medicine or food or car or technology. In other words, having a computer so that their children are able to do schoolwork, compete in school. So housing is kind of, if you will, shoved a lot of these other issues aside. So I referred back to the study. So this sounds pretty gloomy unless you really think about, well, we have, if you will, the capacity to try to, first of all, take the knowledge, take the data that we have, and start to make inroads to get back to a more balanced, if you will, housing sector. We have to have the will to do it. We certainly can't allow every project that comes up for a vote to be beaten down or to be, if you will, challenged for personal preference. The community has to decide that it is going to invest in housing for all income groups, that it is going to try to hold on to or try to retain a lot of those individuals that were once able to live here comfortably. And we would obviously hope that they would be able to stay with us, and also that we want to have a population that can serve our community, including librarians here, including school teachers and nurses and police officers and others, people working in the service sectors that could be residents of Stamford, as many of them would like to be able to live in Stamford.
Thank you, Vin. So you all have heard a lot, and we're going to turn to the audience now for their questions and comments and input. And of course, if you have any data questions, we have Ben Wade, self-described data nerd. So I'm going to start right back here with Bianca. I'm going to go from the back and go to the forward.
I am so thankful reading this report, this comprehensive report from Stamford Health. Now, since Stamford Health has conducted this comprehensive report and is now handing it to the policymakers in the community, affordable housing, we're looking at this data, has doubled based on the report here, the lack of access to affordability housing. What's concerning is we're telling our community that we know there's an issue. We can look around, seeing new developments are being erected every other week. And what are the mixed message that some people in the community are gaining is we're talking about it, but when they're walking around with their kids and sleeping in their cars, it's not a community where they are having access to housing affordability. So I like how Ben mentioned the 3-year strategic plan. I hope this issue is taken upon aggressively, because Stamford Hospital has done the big legwork, which is providing us with the data and the qualitative, which especially the qualitative aspect of the data we already knew. So now we've had community conversation number 1. I hope to see community conversation number 2 around each priority area and the development throughout the 3 years. So as a Black person, I don't have to come here in 3 years looking at this data and not understanding, of not having to wait for Stamford hospital to pull the data 3 years from now and telling us that our community is pushing groups of people, because that's what the data is telling us. This is not hearsay, but thank you.
Sir?
I have a whole bunch of questions. I assume I'm limited to one subject area. Okay. Go back to the subject area I brought up. I heard nothing. The Stamford Health has a tremendous amount of services, and rightfully so, aimed at women, women's health. When you look at what it does for men's health, it ain't there. There is nothing, and men are dying quicker. That's why all of the nursing homes have lots of women and not so many men. The men are dying, and no one seems to give a damn. The politicians, even the men don't raise it. They can't even get organized like the women have done. The women have done a terrific job. The men have done a sucky job. It's absolutely terrible. What is the hospital doing about men's health? And for example, creating a men's health center where which can have a focus on men's health issues. And they're real. They're just as real as women. Yeah, women have babies, and you could factor that into the equation and all that. But basically, men have the same kind of issues as women, and they're different. Yes, medical issues are different. Anyway, I'm rambling on now.
So I think I love your passion. You've actually inspired Kathy to get up and say a few words.
So, the biggest and most important thing that men can do to improve their health is to limit their risk factors, right? And when we look at the causes of death, premature death in men, it is because of not managing risk factors, whether it's diabetes, heart disease, obesity, etc. And the way in which we are trying to address that is to provide access to primary care. The most important thing everyone in this room can do is have a relationship with a primary care physician that you trust and that you like and that you can talk to. Because when you do that, they are going to do a comprehensive assessment. They're going to look at your own personal risks, and they're going to give you and help you work collaboratively on a plan to address those risks. And the other way in which we're addressing that is the services that we have. We've expanded cardiology, screening for cancer. I just came from a celebration around the fact that lung cancer is decreasing, and it happens to be the largest cause of death for men and women. And that is decreasing because of screening and the capability to identify smoking cessation programs, all the things that we have. Getting ourselves in to see those kinds of providers that can help us to live a healthy life, that is the way in which we do it. And that's how we've been addressing it and targeting those resources. Urological health, we've brought people to the community to address those kinds of things. So getting a primary care physician is the most important thing that any male or female can do in the community, and we've been expanding that as well as access to those specialty services significantly. But thank you for bringing it up. Men deserve it. I have 3 sons. Men deserve it.
Why then these women's health facilities, when you're saying the primary care physicians can take care of it all and steer the patients?
No. Well, we have special places for women because of the reproductive concerns and issues that need to be addressed in those particular locations and privacy associated with all of that.
Men have the same kind of issues.
Yeah.
Yes, now that biological men cannot carry a fetus.
Right, for sure. We will agree on that, but that is the way in which we are addressing those concerns.
Okay. Thank you very much. We're going to move on to some other questions. We're going to go over here and then over to you. 1 second.
Thanks. Question for John. I love that you said that we're expanding some of the clinics in Longridge, et cetera. And I wondered, to the point of many of the panelists and what we all know with the cultural needs, what have you, what about expanding them into the neighborhoods that need them? Is there any talk about building these
new clinics there instead of at Longridge, especially for people that don't have transportation access, housing, et cetera, et cetera?
That's a great question. Yeah, and again, I see mental health as having three components: feeling lovable, having starts with self-love, right? Being able to give and receive love, feeling capable, having agency, and feeling connected. I don't think we do a great job sometimes having people feel connected to the community. So we have a van, people might have seen Liberation, this Peace, Love, and Liberation psychedelic van. That's a wellness van. That's specifically, though, for the overdoses. Health vans out in the community have been known for years for a public health strategy to really address these issues. We're actually wanting to expand that van. Right now we give out Narcan, we give out clean syringes, because if 2021 or 22 may not be the year of recovery for you, but we want to keep people alive, right? But now we're trying to bring a nurse on that van. We try to provide low barrier care. It's all about engagement. You don't oftentimes need licensed clinicians or physicians on the van. You need peers, people that look like those
Absolutely.
that we serve, and that makes a world of difference for connection and engagement. So I'd be a big fan on expanding our van to make it more of a health van and partnering with Stamford Health to do that and meeting people where they are, because I don't think we do a good job. In the addiction field, we do a lousy job of that. Only 1 out of 10 people come in for treatment a year that could benefit from alcohol or other substance use treatment. Because of
think
stigma,
that-
because of access, because of insurance, because we have a sucky system that treats it as an acute disease. Sucky's, I stole that man's term, sucky. That's a clinical term. It's a chronic disease. We should have recovery coaches and peer educators over time giving people support, both for mental health and for substance use over time, instead of just this acute 30-day treatment, which is stabilization. But when people need treatment the most, that's when we need it. The most successful addiction treatment model is the physician's monitoring program. Why? Because they monitor them and support them for 5 years, and they have over a 90% success rate. If you work with somebody long enough and you engage with them, that's what's going to make a difference. But yes, I absolutely agree. We need to expand our efforts and outreach in the community and meet people where they are everywhere.
Agree with everything you say, and I add prevention services to that van and the neighborhoods.
We got Ingrid Gillespie behind you, who is our Director of Prevention Services and was with Communities for Action and is leading that way. So she's here for Ingrid back there.
Great to hear. One other quick question for Ben. With the data that you presented regarding behavioral health, I know this was a sweeping overview and what have you, but I'm assuming that you drilled down into specific mental health issues and specific needs instead of overarching needs. Is that correct?
So
In the survey?
So this survey, we did look very broadly because we were surveying the entire population on all 5 of those social determinants of health. We did look very broadly.
Okay.
So most of the questions were focused on broad behavioral health needs like anxiety and depression.
Okay, and is there a component that's coming or an opportunity to get specific, not just, excuse me, quantitatively, which I think is critical, but qualitatively, especially for mental health issues?
Is there something in particular that you have in mind?
Well, there's a ton of mental health issues that need to get addressed, but they have to be identified specifically and then
One is very easy. Children go to school thinking what's going to happen. And that's part of our...
Yeah. So I guess what I could
yeah,
say
there's
is
there's tons. I
yeah,
just didn't know.
So in addition to the in our last community health needs assessment, we also identified behavioral health as the greatest concern. And so over the course of the last 3 years, one of the things that we did is we brought a very diverse group of stakeholders from across the community to come together and talk about what are some of the most pressing gaps in the behavioral health system that we as a community could address. So I think to your point, it wasn't really about quantitative as much as it was about bringing all the stakeholders together so that we could identify what the major needs were.
Great. And were the stakeholders not just professionals, but community members, especially in the neighborhoods that the percentages were highest in?
In this case,
I would
no,
advocate for that.
it was representatives from groups that worked very closely with those communities,
great.
so that we could hear their voices. And the rationale behind that was that we wanted to make sure that we weren't just hearing from one person, we were hearing from people who could speak on behalf of a broader group of the population.
Great. I'm just anxious to see the data put into action. And thank you for all of the collection that you did.
Absolutely. We're anxious to see it put into action as well.
Thank you.
I'd like to mention one thing about this area. First of all, like the rest of the country, we're short of doctors, we're short of teachers. Now, Norwalk has a program that teaches students to help out at Stamford Hospital, and they do a wonderful job. But when you come back to mental health, kids are not stupid. When they see what's happening around them with climate, fires all over the place, animals dying all over the place, they go to college and they come out in debt. First of all, this country needs a decent medical system, a one-payer system, and not all the jokes that we're fooling around with. The last thing I have to say is, how many people here have ever tried getting an appointment with a doctor and told you have to wait 3 to 6 months? I think I've said enough.
Thank you. Thank you for your input.
Hi, Justin McGann with the Fairfield County Business Journal. Two very quick questions. One is, I was covering the campaign trail, and housing was a huge issue, much discussed, but almost always from an economic standpoint. Of course, there's a huge economic impact from being housed or unhoused, but I'm wondering what the panel might think about why the medical impacts of being housed were so rarely discussed. And then for Ben specifically, I'd be interested to know why the statistics are Stamford and Darien, obviously the focal point, but why the comparison was just to Connecticut and Broad and not to other similar cities along the coast, Norwalk, Bridgeport, New Haven.
I'll take that question first. There wasn't a very specific reason. We didn't make a decision not to compare it to other like cities. We chose to compare it to Fairfield County and to the state overall.
Okay, thank you.
Yeah.
But my broader question for the panel.
Let me take a shot at some of that. I deal with members of my congregation all the time. One member in particular, he came to me looking for help for housing. His housing, actually, he had to be out the city because housing is so high. Where his dwelling was actually an illegal apartment. And because it was an illegal apartment, the city came in, condemned it. Now the onus is on him to try and find someplace else to live. And he had like 90 days in order to do that. And so about every 2 to 3 days, I was getting a call, Reverend, I'm stressed out because I know I have to be out and I can't find a place to live. I don't know what to do. I've gone to try and get senior housing, but they said I'm number 95 on the waiting list. And when you talk to someone about senior housing, they say, well, the only way the apartments become available is if either someone dies or they move on most of the time. And so that 95 being number 95 could take 2 years in order to happen. And so literally, mentally, he was stressing out the whole time. Because of that, his blood pressure was rising. And, you know, one time, Rev, I need to go get my blood pressure medication, but I don't have the finances to do that. All of this arises out of the housing issue.
And I'll just add that for the immigrant population in particular, for example, you have families or the day workers, and actually a family that we were working with last week, where you have 8 people living in a room, right? If you take COVID or flu or all the myriad viruses that we are dealing with at the moment, when you have 8 people in a room, chances are that you're going to have 7 more people sick that you initially expected, right?
And I just want to say hats off to Stamford Health because our agencies from Bridgeport through Greenwich, and this is only the first time I've actually heard a healthcare system talk about social determinants. It's a new concept, and to actually understand social determinants is pretty cutting edge, and it's just new in the conversation. So hats off to Stamford Health to recognize that connection.
I am mindful of the time. We're 10 minutes beyond, so if we could have 3 questions. Start here, and we'll go here.
Hi, my name is Sue Halpern, and I live in the south end of Stamford. I've lived there 40 years. I'm a registered nurse. And my concern, and thank you very much for this community conversation, and there has been no comment about how air quality affects our health in Stamford. And with 15,000 people, 20,000 people now moving down to the south end, we've been trying to get some type of community outreach as far as how the air quality down there could be affecting people's health, because you have apartment buildings built right across from the asphalt plant, sewage treatment plant, the junkyard, you have a cement processing plant, and this is all around us down the south end. So I think going forward, there really needs to be some type of study or some outreach to the neighborhood to see, how this air quality is affecting the people that live down there.
Thank you. Thank you. A good comment. Thank you very much. Thank you. Ma'am?
Good evening, everyone. My name is Kendria Walston, and I'm the 9th District Board Representative for the West Side. And my question is for, I can't see, Mr. Liberation. Don. I have some constituents. They were calling me like every morning before 9 o'clock. And, they're worried about their tenants who are moving out. And in turn, I'll start, turning the heat up on some of the people at the city. And I turned around and I told her, I said, I know the guys are out there, they're, they have no place to go. And I told her, I said, you need to look at it like they have a mental illness. These people are far away from home. They don't have their family. They're missing their family. They don't have a job, so on and so forth. So I reached out to another representative, and she told me about your program. And the thing is, like, when they become inebriated, the ambulance will pick them up. They'll go to the emergency room for a few hours. Then they come back out and do the same thing. And, and it's a mental illness. And so I don't know how we could wrap our hands around not just them, but so many more people who are walking around. They're here illegally. I can't do this. They're feeling despondent too. And I try to help everybody. So I do have compassion for the ones who are in this town with no place to go. So that was my one comment. And as far as the housing, I'm a little bit different. I know we always say that we want our firemen, our policemen, our teachers, and our nurses. But the ones I know, they don't want to share a wall. They want a home. So I know we had something really big go on last month, and my position is that as far as affordability for the people here in Stamford, we have the retail managers. They're not making that much money here. We have our restaurant workers. They want to live here. We got our movie workers, people who are not making that median income. And I do have a problem with the numbers also, because I want to know the exact number for Stamford. I don't want the Greenwich number factored in. I don't want the Darien number factored in. We need to just deal with Stamford to find, so we can fine tune and take care of our own. Like one of my pastor friends, she's like, how do we have all these people come to our town? But they don't even know the struggle that we've been going through over the years to try to get housing. BL&T, they're building up everything, but they're overloading our system, the water and all of that. Prices of everything have gone up in this town. So, I just wish the numbers were a little more direct for Stamford. I'm not Darien, I'm not Greenwich, so I really don't want to hear their numbers. So that's just me. Thank you.
And I just want to comment on that alcohol piece because I failed to mention that we actually have started a new initiative, and Stamford Health's coming to the table, and it was brought together by Assistant Chief Red, who wants us to look at a managed alcohol program for individuals who aren't interested in stopping to drinking, but we want to keep them out of the emergency department, we want to keep them out of the criminal justice system. It's meeting people where they're at. When you meet people where they're at, you only walk away with new understanding, love, and compassion. You walk away with any other issue, that's your problem. That's your issue. Time to get your own therapy. So we are really believing in that. And I just also hats off to Stamford Health because they have recovery coaches now in the emergency room. We'll ask people, how can I help you in your recovery today? And what does your recovery look like to you, which is multiple pathways to recovery. We want to take it to the next step and have our overdose response team and our outreach team go to the rest of the hospital because they're there for alcohol and substance use related illness and ask them, how can we help you today? Basically, how can we keep you alive and keep you out of the hospital? That's the other 9 out of 10. So this Assistant Chief Red's initiative, I think, is going to go a long way with saving lives in that community. It's for fentanyl and it's for heroin. It's for opiates. It can only do a reversal for opiates. In fact, I think in the emergency department, if somebody's unconscious, there's 3 protocols, and one of them is giving you Narcan because it's so harmless. It won't do anything except save your life if it is an opiate overdose. It doesn't reverse any other substances like benzodiazepines, but it is life-saving. Everybody in this room should have Narcan and understand how to use it because you don't know if you're going to come up to a loved one or just somebody on the streets that might be dying of an overdose. We did, our overdose team did over 54 reversals just in the last week. That's 54 lives saved just being out in the community, seeing people that are overdosing. Ingrid Gillespie will be our contact person there. She actually does training with Maggie Young, if you know Maggie, our Chief Recovery Officer, and we'll meet you where you're at. We'll do training. We were at an event, a vigil in Greenwich yesterday, and we gave over 100 Narcans out just for people that showed up. So just I'll give you my contact information, and we would go out and train anybody who's interested.
Thank you, John. We do have to wrap up, and I did promise this woman right here. Here you are, ma'am.
Okay, good evening, everybody. My name is Jenny Canepa. I'm a community leader. First thing, I want to say thank you for all you do. I keep hoping for the next 3 years. The topics you mentioned are really good. But in regard those topics, especially behavior, I wonder to ask for the next year if you are considering to hire people, professionals, can be bilingual. I'm not talking about for Latin community. I'm talking about also for the Afghan community, Ukraine community, Haitian Creole community as well. Because I can see during this last 3 years during the pandemic, many parents needs the help. First thing, they have to wait months like somebody else mentioned. Second is a language barrier. And people also doesn't feel comfortable sometimes to open what happened. It's a lack of communication. Yeah. Another thing is, I love to see data, and thank you so much for your presentation, was great. But at the same time, I was trying to follow in the package. I got it in the entrance. But for me, and for other people as well, I find it that some people are visual. And those pictures you show in the slide, in the PowerPoint, for me was easier to understand the numbers you show in the package. And my question came to my mind. And I say, in that percent, you say like a Hispanic community, we can say Hispanic or maybe the other communities. In that counts also the people who cannot be familiar with the technology, because in the past, many people from the community doesn't have devices, doesn't understand also the surveys sometimes are presented only in English, and most of them, depends of the level of education, doesn't know how to navigate in the website. So that's my another concern, because at the beginning, the first month I hear like, 100% positive feedback. And I was thinking, in that percent, I'm not in there because I wasn't friendly with technology. Right. So that is another thing. Yeah. Thank you so much.
Thank you so much. So I heard two things. The first is your point about language and are we able to get a representative sample? And I totally acknowledge the concern that you're raising. And it's one of the reasons why we paired the quantitative surveying that we did with the qualitative interviews and focus groups that we did. And when we did those, we spent more time talking to communities that would be less likely to respond to the survey for all the reasons that you talked about and perhaps others. So we tried to solve for that in the way we did the study through our qualitative work. The second point the first point that you made around language, I think is a very important one. It's one of the reasons why we try to collect that information from patients. It's one of the reasons why we look at this information today. And it's something that we think about when we're hiring clinicians to work at Stamford Health, to make sure that there are people on our staff who look like the community that we serve and are able to speak with and work well with the community that we serve. Beyond that, we do have many, many resources that help our clinicians communicate across language barriers, like a language line that has dozens and dozens of interpreters and that are available to our staff around the clock. So it's something that we take very seriously and will continue to take seriously as we go forward. Thank you so much.
Okay, well, I think we have to wrap it up given the time. If anybody still has a question, you can join me up here and I can perhaps help you out a little. But otherwise, I'd like to thank our panelists for their time tonight. Thank you very much. And I'd like to thank Stamford Health's President and CEO, Kathleen Szilard, for being with us. Have a good evening.